All right. Our next person we'll be talking to this morning is none other than Jerotich Seii. She's no stranger to this show. She calls herself an active citizen. She now joins us by way of Skype, just here to talk to us about humanitarianism during this pandemic, during this COVID-19. Jerotich, it's great to see you this morning. Hope you are well, wherever it is that you are. Perhaps you can begin by telling Kenyans what this should I call it a philanthropic event that you have going on, which right now has hit 1 million. Could you tell us more about it?
Good morning, Zinzi. It's good to see you. Thank you so much for inviting me. Yes, I'm at home, trying to stay at home. But thank you. This initiative, and first of all, I want to thank every single Kenyan on Twitter, in Kenya, in the diaspora, that has contributed to this ad hoc initiative. What actually happened was 3.5 weeks ago, someone reached out to me and asked for 150 shillings so that he could buy some unga for his children. He didn't even want money from Boga. He just said unga. And I tweeted that out along with an op-ed that I wrote that is called Humanity in the Time of COVID-19. And from that, the outpouring of support was incredible from Kenyans on Twitter. People wanted to help this family. And I say to myself, instead of just helping one family, why don't we see how far we can get with this support? And today, Zinzi, we're looking at 1.2 million shillings raised. It is incredible. I have been touched. I am overwhelmed. I am grateful on behalf of the almost 550 families that we have been able to reach so far. So this is how it started, ad hoc, just to say, you know what, cash transfers work. While people are trying to get themselves in order, to figure out how to support Wakenya during this time of COVID-19, I say, let's just be practical and let's act. And I'm a firm believer in cash transfers because cash transfers are dignified. Cash transfers, you don't ask many questions. You don't interrogate. You don't lecture people about their spending habits. You recognize that this is an emergency. People have suddenly lost their sources of income. Yes. And we need to be able to stand in the gap.
All right. I mean, Jerotich, one would say definitely what you're doing is quite selfless. But here's the thing. It's not every day that we experience a pandemic as a human race, as a continent, as a country. And here's the thing, Kenyans truly have a heart for giving. We've seen it in previous years. Remember Kenyans for Kenya? The drought situation, how Kenyans contributed and how immensely Kenyans, I believe, if my memory serves me right, it even passed over 50 million Kenyan shillings in contribution, in donation, just Kenyans sending money to that pay bill number. Kenyans participating in marathons that we see year in, year out. So, Jerotich, one might be asking, why should Kenyans contribute at such a unique time, at a time where it's so pressing, at a time where Kenyans are wondering, is it food I will buy, or is it rent that I'm worried about, or is it school fees? All right, we seem to have lost Jerotich there. We're trying to get on the network and see if we can get her back. But just very quickly, Jerotich Seii she's an active citizen, just here giving us her thoughts. We want to discuss humanitarianism during COVID-19. Kenyan cases now stand at 225. Kenya cases are now standing at 225. 53 Kenyans, or rather 53 of those people recovered cases now stands at 53 rather. That's the number of recovered cases in Kenya. Those who have lost their lives to COVID-19 in Kenya, that number stands at 10. Allow me to repeat that again. The current numbers as of now in Kenya, we have confirmed numbers 225, 53 recovered, and 10 that have lost their life. I believe now we have Jerotich Seii back with us via way of Skype. Jerotich, sorry for that. Allow me to repeat my question again, which was, why should Kenyans contribute at a time when Kenyans themselves are sort of trying to figure out, how will I feed my family? How will I pay rent? It's such a unique time. This is not a normal economic slump. It's a very unique time we're living in. And seeing how Kenyans have contributed in the past in the other initiatives, why should Kenyans contribute, Jerotich?
Because, Zinzi, and that's an excellent question, because when we are in the middle of an acute phase of an emergency, this is when our humanity counts the most. And I want to tell you a little bit about those who are giving. They're not giving from their bounty. Trust me, I have received 50 shillings. I've received 10,000 shillings. I've received 500 shillings. I've received variations of that. Primarily, we're looking at Kenyans who have looked and said, I can squeeze from my unga budget to help someone. somebody I don't know, somebody I will never meet in my life, but somebody who right now is sleeping hungry. And yes, I understand it's called donor fatigue. You know, we keep giving a drought, Kenyans for Kenyans. At what point will we have a situation where the government is able to provide the immediate and adequate social safety net required to keep people alive? And so what we're effectively doing is standing in the gap. And if you allow me, Zinzi, to say, we have a budget that has been allocated for this pandemic response.
Yes.
We are talking about 550 families reached just through this ad hoc cash transfer initiative. You're looking at so many groups distributing food. You're looking at Team Pankaj, for example, that's doing a fantastic job. Why are we all so busy while the government is still in committee stage? And this is my big beef, if I put it that way, with the emergency response. When the government treats socioeconomic cushioning, acute phase response, like a development program, where you manage it by committee, where you have endless meetings and make plans. I understand the COVID-19 fund, the committee, is waiting to hit 1 billion before it starts moving. What I am trying to tell Kenyans is that you can move, even with 10,000 shillings. That's where I started. And each time I wanted to close out the fund and say, thank you so much. We have now helped 20 families. It became 30 families, 50 families, 100 families. Are we going to continue until the government wakes up? So
here's the thing, Jerotich. At the end of the day, the same government, the Kenyan government now has the COVID-19 fund. That's where all donations are being channeled into. Do you support it? And will you also be channeling some of this money there?
Look, I support the establishment of any pandemic response that the government comes up with, provided it is people-centered. I'm very sure that the members of the committee, who are captains of industry and excellent professionals in their own right, have their hearts in the right place. However, I think that the committee has missed the mark in terms of understanding the realities of acute emergency and the life-saving activities that need to happen. So the bottleneck that is potentially being created by the government, forcing people to channel their assistance through them, this will create untold suffering. So if, for example, and let me be clear, the committee did walk back what CS Matiang'i had said in terms of halting the distribution of donations. So I recognize that, and I thank the committee for clarifying. But I would like the committee to, rather than think about policing us and micromanaging us, you cannot do that to philanthropy. These are Kenyans from all over the world, in the diaspora and in Kenya, from all corners of the country, sending their money. Don't police that. Do your work. Start the cash transfers, distribute food, commodities, do the necessary lobbying to keep people's livelihoods afloat. Don't waste time looking at me. And to answer your question, absolutely not. I'm not channeling a single cent that has been donated by our Kenya for this ad hoc cash transfer initiative to COVID Fund Committee.
And Jerotich, it's because of your lack of independence?
We are not doing
that. Is it because of your lack of confidence in the government that these funds will go to the vulnerable families?
You know, so far, Zinzi, and if I'm completely honest, and you know me, I have very sharp elbows in the ribs of the government around governance issues, around corruption. But my op-ed, which is Humanity in the Time of COVID, said when we have an emergency, we have to have all hands on deck. We need to seek appropriate expertise where it exists. And trust me, it exists. What the government is doing is prevaricating and being extremely slow. And so, no, I do not trust the government's socio-economic pandemic response. On the hand, I want to credit the Ministry of Health. Under all circumstances, it is doing the best it can. But if the government does not put people at the center of its planning, does not swiftly respond to save lives, they will actually end up undermining the biomedical efforts that are in place to stave off the worst effects of the pandemic.
Okay, I hear you, Jerotich. Then what's your accountability plan? How will you tell Kenyans this is how much money was donated, this money went to this number of families? Accountability. This is not the first time Kenyans are contributing to an initiative where Kenyans were not told this is how your money, this is how this is where your contribution went to. So talk to me about accountability.
I'm so glad you asked that question because, as I mentioned, my sharp elbows, I'm always on about accountability. From the very beginning, down to the last shilling. In fact, I'm right now with about 150,000 shillings that I need to account for, which will be online in the next hour or so. I have provided detailed accounts, the amounts raised, the amounts disbursed, because sometimes we disperse 2,000 shillings, sometimes it's 4,000 shillings. I have been extremely clear down to the cost of kutuma, because we're using M-Pesa. We're not actually going door to door and meeting people. We are using M-Pesa to send money. It is public. It is online. And this is exactly what we push for. Others have been saying I need to, print and publish the M-Pesa statements. I believe very much in protecting the dignity of the people who we are assisting. These are human beings like you and me. You wouldn't, Zinzi, like to have your name and your phone number published to say Zinzi received 2,000 shillings. No, these are people who are like you and me on the brink of crisis. You have chefs, you have occupational therapists, you have chemical engineers, mama mbogas, mama fua, tailors, electricians, mechanics, welders, traders, mitumba sellers, people who haul loads from there at country bus and so on and so forth. You have everybody. You have teachers. You have community health workers. I am not going to expose their names. However, I will share down to the last cent. And at the end of this initiative, whenever it actually ends, I would invite an accounting and auditing of my M-Pesa statements to ensure that all the money that was received went where it went. And in actual fact, I may discover that I commingled my personal funds and spent even more sending funds out to Kenyans. So accountability is key, and I have been extremely meticulous, and it is in the public domain. And this is exactly what we want the government to be with us: transparent and accountable. That 12 billion, 1 billion, however many billions they have, can we have a ticker tape showing us how much money has been spent, where it has gone, how much was spent on food, how much was spent on sanitizer, how much was spent on transfers. And we have to be lean, mean, flat, and effective. I run this alone. It is laborious. It takes many hours, but I want to ensure that Kenyans get maximum bang for the buck.
Right. Here's the thing, and we will talk about the private sector in just a little bit. From what I'm gathering so far from our conversation, Jerotich, from this discussion, you really are emphasizing on this term, the dignity, the dignifying of the people that we are helping. We saw recently a stampede at a low-income neighborhood where 2 women ended up losing their lives when a member of parliament was sort of dishing out goodies during this pandemic time. Talk to us about why it's so important that even as much as you're here conducting philanthropy work, it's always good to remember the dignity of these people. 2 women, Jerotich, lost their lives during that stampede.
In fact, Zinzi, I've heard that more than 2 people lost their lives, but the officially reported number is 2. I call it pandemic pandemonium. Look, for those of us who have worked in humanitarian situations for years, like myself, we know better. We know better than to have the kind of chaos that ensued that day. You have to treat people who are already on the brink of starvation, of homelessness, of destitution with dignity. People are people. Poor people are not poor because they chose it. There is no dignity in poverty. Nobody would wake up in the morning and say, oh, I choose to be poor. And when people have lost work, and remember, there is dignity in work. There's dignity in those shillings you get every day. Even if I argue that it is underpaid, there is dignity. So when you see people at such loose ends in underserved communities, why are they in underserved communities? And why would you then subject them to a non-social distancing event such as the one we saw? With pandemonium, mayhem, injury, death, and we still hear scandals of some of those food supplies having been stolen. So this is not the way to handle an emergency response. It never will be.
So here's the thing, Jerotich.
We dignify our brothers and sisters.
Right. And here's the thing. We've seen members of parliament who have been quite quiet for the past 1 month, in the past 2 weeks now, coming out and giving out goodies, bags of goodies. But here's my question, Jerotich. Where do we draw the line between philanthropy and self-gain? Doing something, even though as much as it's out of your own pocket, and more so for our politicians, because we hear them saying that "Hii pesa imetoka kwangu. I'm the one who is personally funding it from my own pocket." Where do we draw that line between philanthropy and selfishness, selflessness, as much as you're doing something for the greater good?
You know, I did stick my elbows into a couple of politicians' ribs a couple of weeks ago, saying this is not electioneering. This is not a campaign period. This is not a time for you to be branding and bragging and telling people how absolutely wonderful you are. When you see people's faces on commodities and goods or donated by so-and-so, that is not dignified. You need to do what you're doing and keep walking. Do not brand anything. Do not care that you're not recognized globally or nationally or in your county for the work that you do. You do it because it is the right thing to do. So I would advise and urge politicians to not confuse the pandemic with electioneering.
And that's the thing, Jerotich. We saw Governor Mike Mbuvi's Sonko dishing out bags, and those bags had very good things, oil, rice, etc., but also had Hennessy, according to him. And according to him, Hennessy, alcohol is good during this COVID-19, but the World Health Organization says different.
Look, how can I even spend any of this time discussing Mr. Party after party? I am completely unsurprised by the fact that he would distribute Hennessy in his care package. That's how he cares. But it is completely the wrong thing to do. Look, Sonko, Governor Sonko, if you have no idea how to use your money, please donate to us. Use all that money that you were spending on Hennessy. Send it to me, and I will account for it and will pass it on to a Kenya. Or send it to the COVID fund if you think they're going to use it correctly. But this business of misleading people, wearing outrageous face gear, headgear, you'd think he was a runway model on some kind of space age show somewhere. Is he crazy? This is not how we deal with the pandemic.
At the end of the day, Jerotich, you have a fantastic initiative going on. Someone would even probably say you're doing work that county governments should be doing, and here you are just doing cash-to-cash transfer. At the end of the day, Jerotich, what would you want to see the government doing in the Ministry of Health? What more can they be doing?
Look, the Ministry of Health is doing the best it can. And if you notice, I don't speak on the biomedical side of things. I'm not an expert in that realm. And I would like to trust and believe that whatever they're telling us to do on the biomedical front is correct, and we should follow all those instructions. However, the rest of the government is being remiss. Let me talk about something, for example, the food value chain, fresh produce, coming all the way from the counties, the farmers in the counties, to the aggregators, to the wholesalers, to the retailers. What are we doing to ensure that we have, for example, sanitation corridors that will allow goods to move, say, from Makueni or from Taita Taveta, tomatoes from Taita Taveta, all the way to Nairobi, so that finally at retail level, Mama Mboga is able to access her tomatoes and sell them to you and me on our way home from work. So I believe that from a multi-sectoral perspective, the government is being extremely slow, and we are relying too much on the biomedical angle to respond to this pandemic. And I've said, and I will underscore, if people are not at the center of the government's planning, the socioeconomic aspects of emergency response, the cushioning, the post-crisis, the recovery period will be chaotic. And that's what we're seeing now. So the county governments, yes, whatever they're doing, keep doing it. Government of Kenya, the executive at central, you need to pull your socks up. You need to stop managing the emergency by committee and by PR and showing us clips of what you're gathering, and get to work. Emergency response is practical. It is tangible. We are not, if I sat here now telling you, Zinzi, oh, when we reach 2 million, we're going to start doing cash transfers, would you even have me on your morning daybreak show? Not at all. But when I sit here, we can attest to what we have done for Kenya. And you will never hear me say it was Jerotich. Yes, I may be the conveyancer, I may be the conduit, but this is Kenyans on Twitter, and I love them all dearly. They're amazing, wonderful people. And interestingly enough, I haven't had too much backlash.
Right.
And those who have tried to cast aspersions, I think are like 1 or 2 literally. Everybody else is seeing the accountability of this initiative and the effectiveness. And for heaven's sake, can the government get busy with this? Why are you waiting for Jerotich and others to do this work. No,
all right.
The government has a primary duty of care to its citizens, and unfortunately, it is failing miserably.
That's true. The government does have a responsibility there. Thank you so much, Jerotich. That's Jerotich Seii. She's an active citizen who has a beautiful philanthropy initiative that she just started on Twitter, showing us that Kenyans, in your own very small way, you can also be of positive effect as we fight this corona pandemic. When we are taking a quick commercial break right now, when we come back, Trevor Mbija will be speaking to Safaricom's Sylvia Mulenge. It's a conversation I promise you do not want to miss. Trevor Mbija will be handling that. See you in just a bit.